Today we're going to work on lower back movement and stabilization. There's 4 exercises that we'll go over, all of which can be done on the floor, so easily at home, either when you wake up or in the evening. It's a great idea to do these exercises. The first exercise we're going to do is part of what's called a McKenzie protocol. A lot of people that are involved in yoga are going to know these as Cobras, but let's walk through them and show you how they're actually done. I'm going to have Lindsay lay on her stomach first. Now the biggest thing with this movement is we want to get extension into the lower back. Okay, extension movements are going to engage the nervous system. Also very good for anybody who's had prior disc issues. The whole purpose is to keep the pelvis on the ground, and then Lindsay will use her arms to push herself up into extension. Don't use the low back to pull you up. The motion comes from the arms, okay? I recommend doing 3 sets of this at 15 reps. If you do have discomfort and it gets worse as you do these movements, then stop the motion. However, if the discomfort stays at the same level or gets better, then definitely continue on. Okay, and again, 15 reps each time. The next exercise we're going to do are called cat backs. And again, in yoga, very commonly they're called, what? What are they called?
Cat cows. Cat
cows, there you go. I'm going to have Lindsay come on up on all 4s. So the big thing with this movement is we want the body to have a 90-degree angle at the arms and at the legs. The motion is going to come from the pelvis, not the mid-back, which is where a lot of people will actually do their bridging. Okay? The first exercise is to get as hollow as possible. So Lindsay's going to go ahead and arch her back up towards the ceiling, as far as you can go. Again, the movement wants to come from the hips, not the mid-back. Okay, so she stays flat here, and she'll rotate pelvis this way. The next movement is going to be arching the pelvis the opposite way. So she'll arch down towards the bottom, and she'll bring her head up as she does that. Okay, opposite, head is going to go down, body's going to come up, and again, really concentrate in moving the lower spine. Again, recommendation for this is 15 reps, up and down is once, and do 3 sets. Okay, the following exercise is going to work a little bit more on stabilizing the low back. Some people call these bird dogs, but the really important part of it is, again, engage your stomach, engage your core while you're doing this exercise. Again, she's in a plank position where 90 degrees at the arms and the legs. What she's going to do is first extend one leg out into extension. So we'll start with this leg here. You're going to bring it to a flat plane. The big thing that I want you to do is most people are going to rotate up this way when they bring the leg into extension. Really try and keep that flat platform on the lower back, right? You should be able to put a plate on your lower spine and it shouldn't topple one way or the other. She'll come back to position, stabilize, and then go ahead with the other leg. Same repetitions, same sets. I would recommend doing each leg 15 reps and 3 sets. Okay? Go ahead, Linz, for one more on the other side. Again, important to keep the back flat. Tendency is going to be for this hip to want to creep up. Okay? Progression from here, go ahead all 4, will be now extending the leg with the arm above crossways. Okay? So Lindsay, if you can extend your left leg. As she does that, the opposite arm is going to reach forward and extend. You want to elongate the spine through that diagonal area and then come on back. She'll set a placing, stabilize the body, and then go ahead with the other side. Arm and legs go out at the same time, making sure to keep that whole platform balanced. This is actually really tough to do in a correct position, so progress from the last one to this one. Okay? The next exercise we're going to do are called planks. You can do them both in a prone facing position as well as a side laying position. We'll start with prone first. To start, we'll go from the knees and the elbows. So Lindsay's going to go ahead and get into position. Now, just as the name says, you want to become a plank with the position of your body. You're going to strengthen through the mid-back here. You're going to tighten your stomach, and your pelvis is going to be neutral, just as if you were in a plank position. Okay? You want to hold that position basically until you feel a fail in the plank. If you start to waver up or down, that's when you're done. Okay? Some people can do it for 15 seconds. Some people are able to do it for a series of minutes. As soon as the plank is broken, stop. Don't force through it or you'll have the tendency to injure the low back. If this becomes easy going from the knees, then what I'll recommend is going from the toes. So Lindsay, if you just start from there, then you can do a plank in this position as your next set of progression. Okay? I would recommend doing 3 sets of that for as long as you're able to hold it. Take about a minute or 2 break in between. The last one we're going to do is a side plank. So Lindsay's going to go ahead and face the camera. Again, I'll recommend starting from the arm and starting from the knee. Okay? You want to be in as straight of line as possible. So I'll have you bring your pelvis forward a bit. Just stay on the knees, bend your knees. Okay? And she's simply going to raise up into a position where she's in a plank position. You can put your arm at your side here if you wish. Okay? And you'll feel that work your QLs and your abdominal muscles. You'll get a really tight pull through the bottom section here, and that's really good at stabilizing the body. Again, as progression goes, eventually you can straighten out the feet and then come all the way from the side here. Okay? Just relax. You'll want to obviously do both sides. Hold for as long as you possibly can without breaking position. Again, I can't stress enough, once you've broken position, that's it. Reset and then wait until your next set to push it. Okay, if you have any more questions, please contact us here at Douglas Dale Family Chiropractic. Otherwise, we'll look forward to seeing you soon.